Okay, everybody, we are live. If you're looking for a solution to treat your child's ADHD and you don't want to use a prescription strength medication, Saffron may be exactly what you're looking for. Let's talk about it. Thanks for watching. Welcome to the show.
That's how I grew this very good mustache.
Hello, everyone. I am Dr. Nate Noble, developmental behavioral pediatrician, clinical geneticist, and you are on our Developmental Behavioral Peds Live show. Today, we're talking about Saffron. You're busy. You're important. We're going to get right down to it. Okay, put your questions in the chat, or if you're watching on the upload, put them in the comments. All right, let's get to work. I am excited to have this time to spend with you. Saffron and ADHD. Oh my goodness. Listen, if you would have told me 5 years ago, 10 years ago, Noble, we're going to be potentially treating ADHD with Saffron, I would be like, wait a second. You mean like from the movie Ratatouille? That's all I knew about Saffron. Something about a rat who makes soup in a Disney movie, right? But it turns out Saffron's got a lot of stuff to talk about. Here's an outline of our time today, so you can decide if this is a terrible video or not. Here's what I want you to see. Here's your outline. What is Saffron? We're going to talk about it. We're going to talk about the uses of Saffron, ADHD and Saffron, the side effects, the dosing, and the availability. Okay. Is it easy to find? And how do you get it? And what are your next steps? If this sounds good, let's keep going. What is Saffron? What is this? As I've said, all I know about it is it came from a movie called Ratatouille where a rat adds it to soup and it's really good. But it turns out Saffron is a lot more complicated. It comes from the flower Crocus sativus. Yep, I said it. Crocus sativus. You go into any store and you say, yo, give me some of that Crocus sativus. And they'll be like, oh yeah, this guy gets to go to the back room where the good stuff is, right? Crocus sativus. And it basically has been used over the years because it has properties that manipulate the neurotransmitters of the brain. So it has a lot of uses. It's been used, as you can see on the bottom there, all over the world. It has origins. It's been used for many, many years. And it is a well-established alternative medication. That's what Saffron is. Okay. So stuff you probably already knew, but let's ask another question. What's it used for? What's Saffron used for up to this point? Before we talk about ADHD, what on earth have people been using Saffron for? Well, a few different things. Food. We talked about that with the movie Ratatouille. Drinks, dyes, perfumes. It's also been used to treat depression and anxiety. Okay. Sleep difficulties, cognitive delays, but most recently, it's been shown to be beneficial as it relates to ADHD, and actually quite surprisingly so. Quite surprisingly so. There's been some research. We're going to talk about it briefly. Okay. And I'm going to show you that I think this is something that we probably shouldn't just step right past. I'm not trying to convince you that this is evidence-based best practice. I'm not trying to say that. There's a lot of studies that need to be done. But at the end of the day, I like this as an option for us, for those of us who want to stay away from Ritalin and Concerta and Adderall and these kinds of things, which are all great medicines. This may be an option for you. So that's what the uses of Saffron are. Now let's talk about where this idea of Saffron and ADHD come from. Like, where do we get this idea that ADHD and Saffron are partners and could mutually benefit from each other? So if you did a quick Google search, okay, just a quick Google search from November, you're going to find this. All right. You're going to find a couple things that pop up. Common spice may beat depression and boost some stuff. From the New York Post, this common spice could help fight depression and boost some stuff. Okay. Now, that's just from the news. Okay. But I learned about this not only from the media, but also from patients asking me about it. And of course, when I hear this, I'm like, Saffron? What are we going to think of next? I mean, really a spice? I feel like that's like comes from the movie Dune. You know what I mean? Where it's like there's this giant planet of spice. Everyone has cool blue eyes and looks awesome. You know, but it's Saffron. This is how I learned about it. And the media is talking about it. So if you're watching this video, you probably noticed that this is kind of something that's happening right now. And I want you to know that there's actually some proof to this. So let's talk about let's talk about the research. Okay. Listen, let's talk about research. And I've air quoted this. Okay. I'm air quoting research because you're my friends. Okay. You're my YouTube internet friends. And I think as a physician on YouTube, you deserve to be taught a little bit about what research is and what it's not. You deserve to know the difference between the National Enquirer, okay, and the New England Journal of Medicine. because it's both information, it's both printed on paper, and it's both sold to you. All right. But there turns out there's some pretty big differences between those two. So I want you to be the smartest people on YouTube. So let's talk about it. So listen, before I can explain to you Saffron and the evidence, I want to explain to you what I mean by evidence in general. Okay. Just give me a minute. Just listen. I want you to be savvy consumers. This is the evidence-based pyramid. At the bottom, there's editorials. At the top, there's systematic reviews and meta-analyses. Okay. I've created a system to help you understand when you're looking at data. Okay. When you're a parent, you're a provider, and you're reading things on, the news, and you're reading things in journals or on Facebook, and people are sharing things. You have to be able to tell very quickly, is this the National Enquirer? Okay, which talks about the bat boy, right? And how there's trials and struggles of the bat boy. Or is this closer to the New England Journal of Medicine? All right. How do I tell the difference? This Noble rating system is it. Okay. Circa 2025. Now, if you see on the Noble rating system a guy with a basket full of eggs, that's a nope. Stay away from that information. If you see a gold bar, that's a why not? Why not try it? And when we talk today about Saffron, you're going to see more gold bars than you are crazy guys with baskets full of eggs. I think there's something here, and I think it's going to be a why not try it. Okay, so let's talk about it. So again, here's another example. If you see the gold bar is up towards the top. The higher towards the pyramid you get, the more it's like a why not. Systematic reviews, meta-analyses, randomized control trials, cohort studies. These are terms that you don't necessarily have to know everything that they mean, but you need to look for those because it talks about study design. Okay. Down towards the bottom, expert opinions, editorials, maybe don't base your life on that. Maybe don't fly to Brazil and try that. Okay. All right. Let's talk first about our first piece of information. The first piece of information I want to share with you is a randomized controlled trial from 2019, published in the Journal of Child Adolescent Psychopharmacology. Okay. So not a terrible journal. Not that I would know, but yeah, I've heard of it. Okay. And the first thing we're going to think about right now, this is a randomized controlled trial talking about saffron, which is Crocus sativus. Now, and what they did is they compared this to methylphenidate, which is Ritalin. Now, listen, this is an interesting study. Okay. Remember, we just talked about this. This is up towards the top. This is evidence that we should probably not ignore completely. Now, for the academics among us who are watching this, and you think, well, just because it's a randomized controlled trial doesn't mean we should always do everything it says. You are correct. Don't get mad at me. It's a small study. There's some flaws. We're going to look at it, but the general idea, the randomized control nature, the design of this study should not be ignored completely. Okay. So it's up towards the top. It's more towards a gold bar than it is to a guy with some eggs. All right. So they took 54 patients. Okay. So not a ton, not a million. Okay. 54 patients from one center, so not from all over the world. Okay, so I hear your concerns, but just hear me out. 54 patients, and they randomized them, meaning they put them in two different groups. One was the saffron group, one was the methylphenidate, which is Ritalin, or the Ritalin group, okay? And the people in the groups, it's randomized, meaning they just randomly picked them. There's no specific strategy. They just put them in groups. And it was double blinded, meaning the people in the study administering the medications and the people in the groups, neither one of them knew which group they were in. Okay. So that's pretty good data. That's up towards the top. All right. They were 6 to 17 years of age. So that's a pretty typical age to treat ADHD. And they were given either 20 or 30 milligrams of either saffron or Ritalin. Now, 20 to 30 milligrams of Ritalin that's not a small dose of a short-acting Ritalin. That's not small. Like you're gonna feel the effects of that. Okay. So, and they use the same dosing for saffron, and they did it over 6 weeks. Okay. So again, not that long of a time. All right. The study design is beautiful, but it needs to be replicated times a million for us to really know that this should work its way into evidence-based best practice. But that doesn't mean this is bad. Okay. And then what they did was they compared parent and teacher rating scales. So people outside of this study just rated the kid on how they're doing overall. Right. So they just filled out forms about how good they're doing with sitting and listening and attending to task and, what kind of response they were seeing. They ranked both groups. All right. And what they found, and make this big so we can see it, is that there was no difference in scores. Okay. I'm going to say it again. There's no difference in scores. So what I'm saying to you is a kid who received saffron and a kid who received Ritalin, when you look at how they benefited on their scoring within schools based on observation, they did the same. They did the same. Okay. So that is an important point to make. And the next thing I want you to pay attention to is there's no difference in adverse side effects. So people tolerated these medicines about the same. All right. And so that is, I think, a really encouraging thing for us. And then just to drive the point home, here's a systematic review and meta-analyses. There's a couple of these as well. Remember, this is up towards the top. Like this is up towards the gold bar area of evidence-based best practice. And they did a couple studies that were, one was a systematic review, one was a meta-analysis, one was an aggregation of all the studies that met certain criteria and then kind of summarized the results. And one was a meta-analysis, meaning of these studies, what was the effect size? Like how good was this from baseline? And so they did these studies. And what they found there was that saffron improves ADHD symptoms. Saffron was found to be non-inferior, so not less than Ritalin. Good tolerance, few side effects. Although, we've already talked about this. There's a few drawbacks: small sample size, short duration, and there's the different methods that people utilize to study this information. It was kind of heterogeneous, and so sometimes that can be viewed as a weakness when you're thinking about something that should be evidence-based best practice or not. So we're still in the early stages, the infant stages. People have been using saffron for forever, for all kinds of different things, right? And just because it's old, just because people used it without, doing the research doesn't mean that they're bad. I mean, at some point, somebody chewed on tree bark and said, wow, my joints feel better, right? And they called it aspirin or whatever. Like that, people do things. There is, knowledge that people come to by way of living on this earth for a long period of time that kind of allows science to stumble into things that can be helpful for people. And I think saffron could be one of those things. So listen, if this is helpful, likey and subscribey. Come on, people who want it. It feels good. Just do it. Okay, here's where we are. Side effects of the medicines. Let's talk about side effects. What did they find out? Well, side effects were pretty well described and were only fell into a few categories: nausea, dry mouth, poor appetite, and headache. And listen, most of those things are the same things you're going to experience with Ritalin. Like 100% you're going to experience all of those things. Nausea, maybe not as much, but dry mouth, poor appetite, headache. So you get a sense that, saffron's pulling on the same neurotransmitters, which in a sense is resulting in the same side effects. So this is important. Like saffron has some punch to it. All right. So that's what we've learned. Now let's talk about dosing, right? Let's get to the practicalities. Should you do this? Okay, maybe I've convinced you, maybe I've not, right? Again, there's some flaws here, and the flaws really are because we just don't have enough data. We don't have enough information. We need bigger studies over longer periods of time. But what we see so far looks appealing. So what about dosing, right? Let's say you're going to watch this and you're going to go and do the thing. Listen, the information is already out there, right? So I'm not telling you what to do. I'm not your doctor, right? But I'm telling you the information on dosing is readily available based on the research that's been done. And here's what we know. If you are 30 kilograms, which is about 66 pounds, if that's the age of your child, if they're less than 30 kilograms, you're going to start with saffron at 20 milligrams. That's based on the research. Okay. Maybe in the future, they'll be dosing that higher, but based on the research, if you're under 30 kilograms, you're using saffron 20 milligrams. If you're over 30 kilograms, you're using saffron 30 milligrams. Okay. Makes sense? Pretty straightforward. Last things, availability. Where do I go? Noble, this is great. This is maybe the greatest live YouTube experience I've ever seen in my life. I doubt it. But I want to do it. I want to go and I want to get the stuff. Where do I go to get it? Well, here's what I found on Amazon. You can buy the stuff on Amazon, okay? But here's what you got to understand. On Amazon, a lot of the formulations that they come in, these kind of pills. These pills come in 88.5 milligram tablets. All right. Now that is, quite a bit more than what's been studied in the research. So, I don't think that's something you have to be aware of. We're not advocating that you go past what we know to be effective. And that's something you may have to explore with your regular doctor. But please understand that if you just go to Amazon and order saffron, you could be getting like Donkey Kong saffron, which is like a bunch. But if you do look and you sleuth around, you can find, I think, some 30 milligram tablets on there as well, which may be a better fit for your child. Okay, pay attention to the dosing. See those little dosing things right there? Watch those. Like and subscribe again, of course. And listen, if this has been helpful, join our newsletter. For crying out loud, it's easy. I don't send them out very often because I'm unorganized, lazy, and lazy with that and busy with everything else. So we're not going to spam you, but you're going to get to know about classes we offer and things that we do and newsletters that we have available as well. You have been gracious with your time. Please like and subscribe, and we will see you in the next video.